Hello, and welcome to the next lecture in our immunity series, where we learn about adaptive and specific host defenses, namely adaptive immunity. So, the intro into adaptive immunity is how we can acquire an infection and be sick and enter the convalescent stage and be better. And then our body develops defenses against reinfection. Okay, and that is the quintessential um, adaptive immunity trait. Okay, and if anything, it's always categorized as slower, but more specific and more aggressive than innate immunity. Okay, so innate immunity is immediate, rather, and you're born with it. Adaptive and specific is I'm going to be targeting this thing, um, but only after I learn about it. Okay, and polio is one of those things where you can get better after it, but you are likely going to be paralyzed afterward. Hence, a ward of patients on an iron lung that actually breathe for them because they are paralyzed. So these patients are kind of forever on a respirator or in these iron lung wards. And this shows just how rampant polio was before we developed vaccines. Okay, and so vaccination has all but eradicated polio from our standard lives, and these wards no longer exist anymore. Okay, so um, thank vaccines for that. So we'll enter our first case study on adaptive immunity, um, and here we learn about Olivia, a infant brought to the emergency room because irritability, sensitivity to sunlight, lethargic, and vomiting. A physician feels the lymph nodes swollen and tender. And so this suggests that she obviously isn't well and might have an infection because she is exhibiting signs and symptoms of an infection. So what might you order to diagnose the problem? Since you don't see any wounds, you can't order a blood culture of the wound, so you just take an overall blood sample and see what might come back, right? So a lymph node, abdomen, spleen, all that suggests that she has a systemic infection, right? Spleen, lymph nodes, abdomen, everywhere is responding. So it's a systemic infection. She starts being reluctant to turn her head, experiencing neck pain. So, seeing the neck pain, in addition to blood count, blood culture, he's going to order that lumbar puncture that we did back in our first case study, where they did the lumbar puncture, check the CSF, right? So we're going to check the cerebrospinal fluid and see if that is cloudy or not. And in this case, unlike our first case, which was a prion disease or prion disease, that was mostly genetic, here we see that it is cloudy, exhibiting signs of meningitis. Okay, so um, or a bacterial infection, if you will. Okay, when you do a blood work, you get that everything is higher than normal, 60% neutrophils, 1,000 instead of 50 to 80. Okay, um, and so you can see that she has a lot of white blood cells that are trying to target this infection, and they might help. Okay, if but with meningitis, we don't want to take chances. Okay, so we should provide at least some antibiotic. Okay, um, just like I had thought, because I read ahead. Uh, it is bacterial meningitis, and without waiting for positive identification from the samples, because that could take a couple of days, you got to send it to the lab. The lab's got to put it on their docket. Then they got to wait overnight, as you can tell from all of our tests that we have to do, because we have to let the bacteria grow. So, admit to the hospital and treat with broad spectrum antibiotics because you don't know which bacteria made the meningitis. There's a couple of different types that could be. Over the next several days, condition began to improve, and the new lumbar puncture showed absence of CSF, absence of the bacterial pathogen in the CSF. Okay, and after this time, they did positively identify it as Neisseria meningitidis, the causative agent of meningococcal meningitis. Okay, meningococcal. So if you break down that word, it just means it's in the meninges of the brain layers, and it is a coccus bacteria, right? So any infection with circular bacteria, spherical bacteria in the meninges would be a meningococcal meningitis. Okay, produces polysaccharide capsule. That is its main virulence factor. So it tends to um, escape phagocytosis with the capsule. It tends to affect infants after they begin to lose their natural immunity, right? And that's what we're going to learn about. The natural immunity caused to her by the maternal antibodies, and at 1 year of age, all of them would have disappeared, and so she can get sick. Important to note, they want to make us aware that there is a vaccine available, and had she had gotten the vaccine, this all could have been avoided. So, if your doctors ever offer a vaccine for you or your child, you should, at my recommendation, take it at least. All right. Well, that concludes our first case study, and we'll get into adaptive immunity in the next video.